I must say that I'm not much of a social media person, but I would argue that I think a lot of people in this pandemic have experienced so much pain and so much heartache and so much tragedy that I think it's important to have this discussion. I think it is imperative that we discuss how this pandemic is really affecting our healthcare system. It is so important. In the beginning of this pandemic, we were all about thanking our healthcare heroes, people who are on the front lines battling this virus every single day. And I feel like we have lost that sense of reverence for people who are honestly every day going to their physician group, going to the hospital, going to the clinic, going to the mobile clinic. Everyone who is taking the time, who is a healthcare professional, whether they're a physician, a nurse, a PA, a hospital administrator, whoever's in the medical field, they are putting their lives at risk every day. And it's one of those things where I really do sincerely view this virus as if it is a terrorist. I really do. I view it as if this entire situation is like we are in the middle of a war. It's with an invisible enemy. We know what it does. We know of the symptoms. We know of the outcomes. But it's like we are fighting an invisible enemy. And because of that, who are the people that are going out and battling this enemy? Healthcare workers. And I am starting to feel a sense that there's just been a loss of that respect. Because as someone because my own father was in the military. And with that being said, I'm a proud military brat. And if other people know this, a military brat is essentially like the child of someone who was in the military. So I have a lot of pride and a lot of respect for people who are out there in this world fighting to maintain our freedom. And I could even honestly apply that same respect to people who are physicians. It's just how I feel or physicians, nurses, anyone who's in the medical field, because disease is just as debilitating, if not more, than any terrorist that could hurt our nation. Because disease is something that we usually, in some cases, are preventable. As you know, there's some preventable diseases. But then you also have some that come out of nowhere and, like in this situation, affected most of the world population. And so that's why I'm thinking to myself, why is it that at this point we are starting to lose that sense of respect and lose that sense of appreciation for the people who are battling this virus every single day? There are some people who have yet to take a break or even to have a vacation, God forbid, or just to take a moment and just regroup. People go into the hospital system, they go into the health system because they are committed to doing their job. And I just wanted to take this time and honestly say thank you to every person who is a healthcare worker, because they are our heroes of today as well. They're just as impactful as people who lay their lives on the line, physically battling out in war. This is our own war. It is a medical war. We are trying to battle a virus. And I really do believe that that is something that we have to put into context and that we have to understand. One thing I can also say as well is that it's been very interesting how, with the new mandate that was established by the Biden administration on Friday, or was it? No, it was Thursday. On Thursday, there were very interesting responses to it. And I think a big picture of this is all about how our healthcare infrastructure is also going to be completely depleted. I mean, there's just, I don't even know how to explain this. Like, to put it into context, I've been doing my own research, and I'll even cite everything below for you so you can see where this is coming across, but or where I'm getting my information from. But it's interesting to say, at least, that there are many hospitals throughout this country that may face temporary shutdowns. And not because, oh my goodness, there have been cases that have been running rampant and we have to close down to protect people. It's not even about that. It's just the fact that because of the mandate that Biden set forth on Thursday, now there are certain staff that may not want to participate in either being vaccinated or to the weekly testing. Or whether or not, it depends on the facility, of course, whether or not they do a mandate of a vaccine or a mandate of weekly testing. It just depends. But at the end of the day, many people are leaving because they don't want to submit to either or. And again, that's their choice. I have no opinion on that because I understand why they feel the way that they feel. But at the same time, there will be implications of that choice. And one of those implications now has to deal with the fact that certain units are now closing. I read that a hospital in New York, I forgot exactly the hospital, again, it'll be linked down below, but one hospital in New York is having to temporarily close their maternity unit, because they're facing critical staffing shortages as a result of that mandate, which means that that hospital cannot provide any maternity care for people within the community at that local hospital. And it's, as far as I'm aware, the one hospital in that area. It is baffling to me how these decisions and how they are leaving a rippling effect that's going to affect patients long term. It's going to affect accessibility to care. It's going to affect employment opportunities for people. It's just, the ramifications of this is quite vast. I mean, it's just crazy. And I think of the fact that because of that, hospitals are probably going to lose a lot of funding. They're not going to have enough financial support in order to support many of their different departments. And that could lead to also maybe a hospital shutting down. Imagine having a situation where they're facing critical staffing shortages and people may end up not having a hospital that they can go to in their community. It's absolutely insane to me. But that's where we are. I do think right now, due to COVID, as you know, there has been a rise in telehealth, which is a great thing. I think that also puts a lot of levity on physicians as well, because then they're like, okay, I can do this from home. So there's a benefit to that. But then there's another piece where it's like, okay, well, even though we have telehealth as an option, being in person at the facility is typically still the preferred method of providing patient care. So it's all about those. It's a very interesting dynamic. And I fear that there is going to be a point where this pandemic is going to put so much pressure on the healthcare system that we are going to lose a lot of the most intelligent, hardworking people due to burnout. And that is definitely something I am nervous about. The fact that a lot of physicians are facing a lot of mental health concerns as a result of this pandemic. Stress, burden, fatigue. In many instances, some people are also facing PTSD because of this. Like this has caused an effect like no other. And this will definitely rock a generation of people. But it also is encouraging more people to get into the medical field, which I'm excited for. I'm excited to see new talent and new innovation as we progressively get out of this pandemic. A lot of great medical voices, public health voices will be added to the conversation. And I think that's a great thing. I just wish that we placed a lot more emphasis on how certain actions are going to affect healthcare. While I do believe that the president's intent is just to make sure that we are protected as a country, I do think there are good intentions with it. My problem, though, is that that intent may inadvertently affect essentially how our healthcare infrastructure can remain efficient and remain at a place where it's not going to collapse. That's my concern. So it's all about having a balance. And that is where I think we're crossing that point where we're no longer going to achieve balance. And I don't want the politicization in medicine. I don't want that at all. And I want to be able to, for us to refocus our energy on actually supporting our healthcare workers so they can do the best job that they can do to help keep us alive and help keep us healthy and keep us safe. It's just, that's all I ever want. I think that's what a lot of people can identify with. But I do think there needs to be more of a conversation about not just about how do we combat this virus, but how do we support the people who are trying to combat this virus. That's my argument here. And so I just think that there's a lot more that we can do. I don't know if we are in the best direction in order to do that, because I do think that certain aspects of this mandate, while again it may help curb and in trying to get people to either vaccinate or do weekly testing, but the other side of it too is a lot of physicians and a lot of nurses and a lot of hospital and health systems are going to face a possible shortage of workers, and that is something that I'm deeply concerned about. So I do want to keep up to date on this and see if the trends change. But that's just something I just wanted to add here. By golly, I talked for a long time. But I just wanted to give that dialogue because I do think this topic is very important. I think it's also very timely, and we need to continue to have this conversation. So that way we can at least do something about this moving forward. And I hope that my conversation about this, I hope that you found something that you could identify with. I know there are a lot of people out there who work in the medical field, the healthcare profession, or just people who, like me, have a deep respect for the individuals who work in those fields or know of someone in this field, that there's just a lot that they're going through. And we need to continue to support them and advocate for them as long as this pandemic continues to run rampant in our society. So I really appreciate you all, listening to this conversation, and I hope you got something out of this, much like I did. So if you would, I would love it if you could continue to watch more videos that I'll put out and join the Medical Maven community. So please make sure you subscribe below so that way you are notified of future videos. And again, like I said, or maybe I haven't before, but I plan on focusing on COVID-19, medicine, health, even policy and law. I want to keep it very broad. As long as it's related to current developments in our healthcare ecosystem, I'll do a video on it. So make sure that you subscribe. I would love for you to stay abreast of all of these changes with me so that we can be a nice community in the future. So I really appreciate you all being here. And again, make sure you subscribe below. Oh, and also you can find me on Twitter at Medical Maven. So that way you can stay up to date on any updates I have there too. So thank you so much. And I am looking forward to seeing you at our next video. Bye.